Now, from CBS 4 News, this is Facing South Florida with Jim DeFede.
I'm Lauren Pastrana. Welcome to Facing South Florida. Jim DeFede is off this week. This past week marked 1 year of the coronavirus in Florida. The first cases of COVID-19 were reported in Florida on March 1st, 2020. Now we're approaching 2 million cases and more than 31,000 lives lost statewide. I spoke to two local mayors separately about their initial responses, what they would have done differently, and what's ahead for their communities. Here's what Miami Beach Mayor Dan Gelber and Fort Lauderdale Mayor Dean Trantalis had to say.
Mayor Dan Gelber, thank you so much for joining us. Just hard to believe it's been a year since the pandemic really first took root here in Florida. We'd been hearing about it in January and February, but March is really when we saw the first cases and sadly the first deaths here in Florida and in South Florida. Looking back to a year ago and looking at where we are now, would you have ever thought we'd still be dealing with the effects of the pandemic 1 year later?
You know, it's funny, a lot of people said at the beginning, the medical and science experts that we assembled said that this was not going to be going away early, which is why I think so many of us really felt like we had to respond, even though at the time it didn't seem as big a deal. When it first showed up in our community, we were telling people, wash your hands and, try to avoid each other. Meanwhile, because of the nature of the disease, it had really, at that point, already spread throughout the community. We just probably didn't know it. But a lot of scientists and doctors were telling us that this was going to be with us for a year. So while it's, I think, a shock to all of us, I think to many of the experts, it was not a surprise.
A lot of tough decisions had to be made in those early days. The decision to close the beach, the decision to close businesses, to tell people to wear masks. Is there anything you would do differently knowing what we know now?
No, actually, I think there's a couple of clear things about this virus. And that is, people talk about whether you should close things and other things like that. Let me point a couple of things out, which I think are really important. First of all, when we contracted our economy, we saved lives. There's no question about that. The more positives we had, the more people we had going to the hospital. Back then, by the way, at the beginning, about 25% of the people that checked into the hospital died. That number is closer to 10% today. So everything we did at the beginning to help people not get infected saved lives. The only regret I would have is that we didn't do stuff faster.
And the problem was we were getting mixed signals at the national level. The medical profession was telling us one thing, the political leaders were telling us something else. So it was time for us at the local level to take charge of the situation. And at that time, we really knew nothing about pandemics. So we decided to do the knee-jerk reaction and we started to close everything down. We closed our beaches down. We closed our non-essential businesses. We worked with other cities in and around the area to coordinate our efforts. We worked with the county. It was just, and we thought, well, we'll close the beaches down till April. By then it'll all go away. And little did we know that you could close businesses and beaches down, but the virus didn't go away. The virus was still there. And that's when we started to learn how to coexist with this virus and still be able to, keep life moving forward.
You mentioned that it was a knee-jerk reaction to close the beaches, close all the businesses. So thinking back now with hindsight being 2020, is there anything you would have changed about the city's reaction in those early days of dealing with the pandemic?
Well, we learned that the open air environment was actually the best place for people to exist. Unfortunately, at that time, we were in the midst of spring break. So while closing beaches today would not be the best answer, at the time, it still made sense because we were trying to tell the spring breakers to go home, stay safe, and remain in an enclosed environment away from everybody else, shelter at home. Because, by encouraging spring breakers to come to Fort Lauderdale or to Miami Beach or any of the Florida beaches, we were also encouraging the after beach activities where people would congregate in small environments. And those were the super spreader events. So I think we made the right decision at that time. But we also made the right decision to later open the beaches to ensure people's safety and comfort and away from the exposure of the virus.
We were in the thick of spring break, such an important time for our local economy, for Miami Beach in particular. We did see at the time a lot of people out there, young people saying, oh, I'll be fine, I'm not concerned. Fast forward now a year, we're getting to that time again where spring breakers, they're going stir crazy. They want to go on a trip. They want to come out here to Miami Beach. What's your advice to people who want to visit South Florida right now?
Well, first of all, we don't want any super spreading events. We don't want huge gatherings. The pandemic is still here. We're in the middle of it. So we just can't have that. We still want people to wear masks. We have a mask mandate in my city. We just aren't allowed to really enforce it because of the governor's executive order, but it makes total sense. It saves lives. It protects the people wearing the mask and the people who are not wearing, who might be around the people not wearing masks. So it's really important. For those people that are coming here because they think this is the place to sort of go crazy, just don't come here. We are, my city is enforcing every ordinance. We are making it clear to people that think that this is the place to let off steam, that they better go somewhere else. We will arrest you for all of our ordinances, and we have been, and we're going to continue to, as difficult as that may be.
The community still reeling, a lot of renters having trouble paying rent, and in turn landlords having trouble paying their mortgages. The lines for food distributions are still very long a year into this. What sort of help is out there in Miami Beach for the community?
Well, it's interesting. Our city, I think probably as much as any city in the country, has to navigate this lives versus livelihood sort of tension, because we're an economy based on gathering and based on crowds and based on people coming together. We don't do physical distancing. Typically, we do the opposite of that. And so for the businesses and workers that are part of that economy, it's been very hard. My city, I'm very proud, has done over 200 food distributions. One of my colleagues, Commissioner Richardson, is out there almost every day with his staff. The city organizes it and helps with all of the queuing up, et cetera. But we've been doing that as much as we can. We reprogram dozens of our employees to just help people get the benefits from the state and federal government, because for many people, they were in a place that they never expected to be. We've also tried to organize our business community so that it is able to navigate this as safely as possible, because I'm convinced a hotel that can present itself as a safer experience is going to get more customers right now and a safer experience. We've also created a contact tracing. We went to the Rockefeller Foundation and asked them to fund a contact tracing just for our hospitality industry, so that those workers and those patrons would have the benefit of that kind of protection. I guess the point is, it's really hard to navigate these two things, and you're going to displease whole throngs of people, but you've got to try to balance them. But of course, your primary concern has to be health and safety.
And now, of course, the main focus is on getting as many people vaccinated as possible. Some of your counterparts in other municipalities throughout South Florida have expressed some frustration, particularly with the governor saying that the vaccines aren't being distributed fairly to all the different communities throughout Florida and in South Florida, and that the underserved communities really need more vaccines. What's been your experience, and how is Fort Lauderdale faring as far as making sure that all of its residents are vaccinated as quickly as possible?
We have done our best to try to establish a relationship with the governor's office. This began when we first started to request testing sites. Last year's Fort Lauderdale was able to secure 2 main testing sites, which is really important because in order to ensure people's safety and do the contact tracing that the county was engaged in, it was important for people to know what their status was. But said that, we've now evolved into the vaccination phase, and again we maintain our relationship with the governor's office and have been able to establish 2 main vaccination sites here in our city. We feel very lucky to be able to do that and to continue that process. I don't know if I can so much blame the governor as I do blame the distribution efforts at the federal level. That has been truncated by a lot of mismanagement at the national level, and it's been very frustrating, not just for the state of Florida, but for all the states, not really feeling as though the pipeline of vaccinations has been as smooth and as easy as it could have been. Under President Biden, we're seeing a much different model, and And just yesterday, the president announced that by the end of May, every adult should have the opportunity to have had their vaccine. I mean, that is clearly progress. And we're very, very thankful for that.
Well, we obviously need more, and we need it quickly. Every day we have less, more people will die and be sick. It's just that simple. The moment you get that protection, you're sort of not in danger and in peril anymore. Our city did something very interesting. I think I don't know of another city that did this. Months ago, we talked to our city staff, and we actually rented industrial refrigerators, and we trained all of our firemen to be able to deliver the vaccine. So since, I think, December, we have been giving out the vaccine ourselves. I think we're the only city that's doing it. I think the city of Miami is now doing it through Homebound, but we are organizing the effort. We're going to congregate living communities. We're going to Homebounds. I think we're about to start. We ourselves are going to do all of our teaching staff over the age of 50, private and public schools in our community. We are getting those shots into arms, and people, of course, can go to the state and now the federal places. We need more vaccine. It does feel like more is coming. I think this week was almost a turning point. It feels like we're going to start getting it in the volume we need to, because the longer we wait and the slower it is, the more dangerous it is because of the vaccine. I think a lot of people feel like this thing is over, and it's obviously not. So we're seeing a lot of conduct that is not consistent with healthy best practices, and we need that vaccine out quickly.
As you said, still not over, even though some people really wish it was, and that they're kind of acting like they think it is. What's your message of hope? Is there anything positive you'd like to tell your community about looking forward? So many people were hopeful for 2021. We're still in it, though, right now. So what would you tell them who are feeling that pandemic fatigue?
We're a couple months from really the end of this. And there's no silver lining when so many people have died and have suffered, and so many have lost so many people. There's no silver lining. But one thing I will say is I saw this was the worst in nature, but it brought out the best in the nature of our residents. 1,000 people have volunteered to give out food to people in need. I talk to doctors at Mount Sinai all the time, our local hospital, and they are courageous to a degree that is just remarkable. So for me, I think this has shown us that we are not just going to get out of this. We're going to get out of this stronger and better, and we have leaned into that challenge. So although there's been a lot of horror to this thing, we're going to come out of it, and we're going to come out of it, I think, better and more resilient. And I think that's something we should all look forward to.
Thank you to both Mayor Gelber and Mayor Trantalis for joining us. Tomorrow is International Women's Day. Up next, we talk to a UM law professor and former member of the White House Council on Women and Girls on how we can take action for equality.